On this episode of the Ask Mike Reinold Show, we talk about the use of special tests. We talk about strength training after surgery, and we talk about some of the systems that we prefer, some direction on where you can go in learning some new systems. The Ask Mike Reinold Show. Helping people feel better, move better, and perform better. Welcome back, everybody, to the latest episode of the Ask Mike Reinold Show. I am up here in Champion PT and Performance in Boston, Massachusetts with Dan Pope, Dave Tilley, and Lenny Macrina. We reversed it just to see if you guys are paying attention in there. So that was a fun episode. We're tired today. I think we're tired.
No, we're fine. We're gonna make it.
No, but this is good. We got one more awesome episode for today that we answer some awesome questions for you again. So Jojo Koplo, take it away, bro.
Ed from New York. Hi, Mike and the crew. Big fan of the show.
Hey,
I want to know as to why in many PT programs they stress on special tests. While one of my mentors says special tests are not so special, can you elaborate on this and make better sense of this, please?
All right, correct me if I'm wrong. Why do PT schools emphasize special tests? One of your instructors said special tests aren't so special.
Right.
Is that what you said?
Mm-hmm.
Perfect. Okay, good. I don't know. Len, you want to take away?
They're not so special, but they're one of your tools in your toolbox.
Len's going to make it a point to say that phrase every episode.
They're special. They have a little, like they give you like 5% information. You know, like you did your whole exam and then you do a couple tests because you value maybe it a little just to kind of give you that one little extra piece of information, but I certainly don't rely on them. There are a few of them maybe if I'm doing like a milking sign for a Tommy John, or if I'm doing a valgus extension overload, or if I'm doing some kind of labral test that I suspect is labral versus rotator cuff, which is like 99% of what we're doing in shoulders. Certain tests like an O'Brien's or a pronated load or a biceps load will give me maybe one small piece of information, but yeah, again, know them, get through school, and then, use them minimally.
So special tests aren't special, but perhaps each special test has its role. Like they all have various validity and reliability. You should know that, right? And you should pick the ones that are applicable to you. But if you don't do special tests, how are you going to try to diagnose it, right? Like you can do all these functional tests, and I think that's great, and I think that's what we should be doing. But if you don't do special tests, how do you pick the diagnosis? Because the diagnosis gives you information. The point of an examination is to figure out what's wrong with the person and to develop a treatment plan.
I think personally a lot of this stems from the pendulum just swinging way too aggressively to one side when all this pain science came out with low back pain and disc herniations and shoulder stuff like labral tears, the amount of stuff we have in the shoulder. I think we just swung way too far into the pain science side and forgot that people need biomechanics and it's really relevant. There's way more overlap. I wrote a post on this because honestly I just got so sick of people arguing on social media for all of it. It's like way more overlap than you guys think. But if you don't do special tests, what if you miss really big important things? What if you don't do a Lockman on someone and they have a blown ACL? Probably you're going to see how swollen it is and stuff, but what if you're like, oh, special tests don't matter, we'll be just fine. You miss a huge issue, like you miss a giant stress fracture in a gymnast, that's acute, and they need to be braced because it's going to be a big problem. Yeah. So if you're like, oh, I'm too good for special tests, and then you really hurt somebody.
There's certain, like you said, Lockman is your best one you could probably do for an ACL. I mean, there are certain ones that are, very valuable, so know them, but
yeah, if you don't do that Lockman, how do you know if you need to send them to a doctor if you saw them first? Or more, we use special tests a lot to assess and reassess, right? So baseball player with that has like a positive milking sign, that has a positive milking sign. We check that through their rehab process to see if they're improving. So we always say with our system here at Champ, we always say we want to, in our examination process, we want to figure out what's pathological and what's suboptimal, right? If you're just looking at suboptimal, you're missing a whole boat on pathology.
Yeah. Well, say sometimes I'm listening to someone subjective and I got this whole idea of what's going on inside in their joints, whatever it is, and I try a few tests. I'm like, well, that's not it. That's not what I was thinking. And it'll change the trajectory of where I'm going too. So
exactly,
rule things in and rule things out and go the right direction.
Mm-hmm. Right.
If it looks like it, doc.
Yeah, I think the main point here is that yes, you should be looking at functional movement patterns and stuff like that, but you shouldn't do that and shun special tests. I mean, you still have to diagnose, right? Jojo?
Glenn from Holland. We see a lot of athletes with shoulder labral tears as well as athletes with knee ACL reconstructions. Do you allow your shoulder athletes following surgery at 1 year out to perform push-ups, pull-ups, bench press, etc., and ACL post-surgery to perform squats at 6 months after surgery? We have a lot of MDs who prohibit these following surgery.
Wow, you're gonna never do a push-up again.
Don't have surgery in Holland.
That drives me wild when people, doctors or anybody, to like
That's
no
an
squats
that's an
or
extreme
anything. Like, are you
position.
ever going to go to the bathroom again? Are you ever going to get off a couch and go in your car? Like, how do
So
you function?
it sounds like you know what our answer is going to be. So you're a year out of shoulder surgery, and they're like, no, yeah, you're cleared. Get back to work. Yeah, go get back to your sports, but no
Are you
push-ups.
going to open doors with your hands?
Yeah, I mean it makes sense. Or ACL. Hey, yeah, get back to high school football, but you can never squat again.
No lunges ever.
Like it's pretty excessive. But I don't know. Maybe why do those doctors think that way? You think?
I will play devil's advocate and say that I think there are some therapists who maybe aren't educated in the biomechanics of some of these exercises, and doctors see the negative effects of people kind of haphazardly, blindly approaching a strength program. So they're 2-3 months out of it, and they're loading pretty heavy when they should not be. The tissue's not back to homeostasis, and then they get flared up, and the joint and the doctor's like, okay, well now we're set back. So I understand where they're coming from, but I think that if that's a discussion between the two, that can totally be prohibited. Like, you can totally get past that.
In most physicians, perhaps these physicians, they seem to be adamantly against
Could
it.
be on their side. That
It
maybe there's not
stinks.
the David literature.
Move to another town where that surgeon's not there. But
There was an editorial on BJSM I just thought was really smart at one point, because one of the things that happens is the strength and conditioning coaches a lot of times will say, like, oh, you're hurting people, you're squatting, you're deadlifting. One of the problems is that the physical therapist might not be preparing the athlete thoroughly enough, and then they get to their activity they're trying to get back to, and they get hurt as a result. So a lot of times what we're doing is we're potentially setting up for failure by not loading them up thoroughly, and then they get hurt in another setting just because we didn't do our job. But then again, the blame doesn't fall on us. We're like, oh, you squatted them, you got them in trouble, but we never loaded them up to the point where they could handle squatting, and then we're saying they're okay, and they're not okay. So it's probably a catch-22. You
Yeah.
gotta be careful.
Yeah.
that's about as fired up as Dan Pope gets right there, by the way. He was livid on that
You go
one.
Kip right now.
You go.
You go there and Kip.
You guys don't know, but he's livid right now.
I can't be next to him.
Great comments by Dan too. We're not in rehab. We're not bridging the gap, and it's funny. We see all these Instagram posts of people trying to do like advanced rehab exercises, right? But they're just advanced variations of a basic exercise. They're still comically basic. Sometimes it's not about making a basic rehab exercise more advanced. It's about actually transitioning them
How
to
many
strength
unstable
training.
surfaces can you stack for a squat?
Yeah. Jojo.
Mallory from Buffalo, New York, baby.
So this is Mallory's second question recently, which is good. So I gotta admit, Mallory, she puts Mallory from Buffalo, New York, baby, with an exclamation point. I feel like JoJo's not selling that emotionally like you probably did.
Maybe Avery Pope should do it.
I mean, I think I even saw like you did it with capitals. Like that was not capitals, Joe. Like you didn't say it with
close.
capitals.
I was italicized.
Yeah. Look, she's from Buffalo, baby. Her football team is so bad. Let's give her something. Let's give her something to be happy about. So we'll feature another question on the show. But you actually have more questions. She's got good questions. But anyway, Mallory.
I am a PT 5 years out in an ortho outpatient clinic. I just took my OCS exam and I'm looking for my next challenge, considering a method/system-based approach like FMS. I am slightly familiar with a few different approaches such as McKenzie, but never fully immersed myself. Is there one you would recommend starting with as a not-so-new PT?
All right, so 5-year out wants to get going on a system, which we love. We love systems, right? So that's good. So we've all been through them, right? We've been through FMS, SFMA, and I think those are good basics. What's that?
McKenzie.
Yeah, so McKenzie's got a system. I'm trying to think. Yeah, PRI, Shirley Sarman's got some good system-based things. We always say, like, look, we like systems, but like I think we integrate a lot of systems here, right? So I think you should pick a system system that you think is compatible to what you feel good about, like what you're passionate about in your profession. You know, so it's funny. So ironically, we've been working really hard on this here at Champion about releasing our system and really like what we've been doing. So really for the last 20 years in my career, I've been looking at all these systems too, just like you, and I've put them together. And it's, again, we say this all the time, but it's made me a mutt of all these great systems that we put out there. But now it's, you know, we want to teach everybody exactly this system, because I've tried so many things that make things better, made things worse, that fit my patient population, which didn't fit it in there. And we just want to release product, like say like, hey, look, this is my system. This is how we do it here at Champion. This is how we do corrective exercise. This is how we do manual therapy. This is how we do strength training, and bridge that gap. Actually, going back to that last question, right? Here's how we do our movement assessment. So we're working on it on our end to kind of get you excited about it. I think this thing's going to be amazing by the time we're done. You know, just an integration of all the systems that we've learned. But I definitely think you should do it. So that being said, where do you think she should start, other than waiting a few months for us? But but where should she start? Where would you recommend? What's the first system you'd recommend?
I mean, we all kind of went the SFMA route as first. I think it's really good overall. I personally, I work in a larger instability-based population, so I personally did like some of the stuff from the FRC system. Andrew Espina's got some good stuff in his FRC course. I haven't taken the soft tissue ones, but I found some really good concepts. I think they're on some of the front edge of some of the research, so it's kind of cool.
Yeah, I would think it has to do with the population you're trying to get into more, and also the therapist you're trying to be, right? There's some really good manual certifications out there. I've taken a few through IOMP, which I liked a lot, and if you're into the manual therapy and you have time, I think that's great. At the end of the day, one thing I heard recently from Chris Johnson I thought was pretty good is that we're constantly looking for like a new system or new program, and I think what's really good about what we're doing right now, and it's good for other people to do, is just to evaluate all the skills you have and try to make those better for a specific population, you know? Like, we have a lot of really good tools in our disposal, but we don't always use them nice and systematically from our toolbox, which Delaney has.
Craft.
Len's got so many tools in his toolbox.
You see all this
Toolbox huge.
stuff. It depends on the tools in your toolbox.
I guess just to wrap up, I think it's important that we don't just chase the newest education opportunities. We try to make our own system better and better for each patient that comes to the door.
Right, and I think a lot of these systems are quite incomplete too, or quite, it's just such a narrow focus that they all try to tell you is the best in the world for everybody. But we all know that nothing's perfect for everyone, right? So that's kind of the point with our system that we're kind of working on here, is it's not saying this is the best system or this is the do. We just say this is our system, this is what we do. And this is how we integrate all those things, and it's because we've pulled from so many other systems. So, you know, so yeah, systems. I just want to say systems again. Systems. Awesome. Is that 3, JoJo? Nice. Awesome. Thanks so much, guys. Another awesome episode. Go to MikeReinold.com, click on that podcast link. You can ask us some awesome questions. Anything you guys want to talk about, fitness, PT, business, baseball, gymnastics, CrossFit, Dan Pope's personal life, Dan Pope's training routine in his garage with or without a hood on at the same time. Does your head get cold?
Sometimes.
Sometimes.
Double hat.
What's a garage?
It's garage.
It's a garage, right? So it's good. Any questions you guys want to ask about, we'd appreciate it. We'd love it. And go to iTunes and subscribe and review us. We'd really appreciate that. We take a look at all those things. And we'll see you guys on the next episode. Thanks so much.